Thank you so much. Thank you very much for SCU and the postgrad organisation for putting this on. It's a wonderful opportunity to share and listen into some brilliant people talking about interesting concepts, childhood and beyond. I'm very grateful for my supervisory team working with me on the PhD project. I'm currently 2 years in, and Professor Oric and Myers and Dr. Grant have been wonderful to work with to this point. So I can't do this without my family. They're currently watching TV quietly, to be quiet. I've been in practice full-time for 17 years. I've worked part-time as an educator in a couple of institutions in Spain and in Australia. While in practice, I've put out 11 papers to date, and I hope to continue that with SCU and the PhD work we're doing here. One of the things I loved was through the grad cert in tertiary education that I completed was looking at how different pedagogical literature integrates different philosophies for learning on the learner's journey and their outcomes. I think that had a lot of parallels and things that can work powerfully in the chiropractic profession. I've got a wonderful cohort of people that have been involved in SCU who are chiropractors that have sort of influenced my journey to this point as well. I know some of those have presented, Dr. Alcantara, Dr. Rigney, Dr. Richards is there. And I appreciate their input and the work they're doing to help move our profession forwards and help improve the evidence base. So what I'll look at briefly is chiropractic as a profession, the context for the study, the rationale, our aims, objectives, and research questions, the significance of it, understanding worldview and philosophy as we've defined it, looking at the theoretical framework for the actual project, mitigating personal biases, a brief touch on literature review, won't do much of that. We'll look at the methods in terms of convergent design and the survey, the semi-structured interviews, and then a small bit on the current data collection. So chiropractic as a profession, when I started in the US 127 years ago now, and as a global profession, there's about 103,000 practitioners in 90 countries and 68 where it's legally recognised with direct access to services in 81 countries currently. There's 48 educational institutions in 19 countries. This is from data that was published in 2019. So the context for the study understands that the WHO guidelines on the basic training in chiropractic note that concepts and principles distinguish and differentiate the philosophy of chiropractic from other health professions. As McDowell, Emmanuel Grace and Chaseling published from SCU, that chiropractic was founded on tone and contended that nerve tension had an impact on health, with spinal mechanics being intimately involved. Dr. Senzon did a 10-paper series on the history of vertebral subluxation, which is a critical component within chiropractic philosophy. This was based on primary sources that uncovered a number of errors and poor presentations of data that's been reflected in the literature. There's numerous publications and global conferences that have considered chiropractic philosophy in chiropractic education. The World Federation of Chiropractic has done numerous agendas on the philosophy in chiropractic education. The American processes have been considered. International research and philosophy symposiums are ongoing, and there's a range of authors that have published around this from a range of perspectives over the last decade. So the rationale for this study is that there's been 3 surveys to date on student perspectives around chiropractic philosophy, concepts of subluxation. This was done in 2015 by GLEAT with North American institution, by DeLuca in Australia and New Zealand in 2018, and then a summary paper of those 2 papers and other data was published in 2021 by Swain et al. One of the comments that came out of those papers was cognitive dissonance and looking at the concepts of evidence-based practice and chiropractic philosophy. The authors discussed that as creating cognitive dissonance. There were some gaps identified in the surveys. There was a lack of longitudinal analysis on the student's journey, and there was nothing on the lived experience of the student. And there's been papers on the schism or divorce in the profession looking at some of that dissonance. So there's no data regarding the lived experience from the transition of student to practitioner regarding the impact of philosophy in education. So one of the things I loved about the concept of doing the PhD is looking at how does a profession express its philosophy through its educational process to generate practitioners that are competent, safe, great at what they do, and express that individual profession, whether it's chiropractic, TCM, nursing, a range of professions. So the aim of my project is to inform educational institutions and professional bodies on how the integration of philosophy in educational and curricular design impacts the transition from novice learner to early stage graduate. The objectives are to build on the previous surveys of Australasian chiropractic students' opinions about their identity, their role, scope, worldview, and future relating to the chiropractic profession. I don't know, Dr. Guccina talked this morning about identity. It's an important aspect. It's to survey as an objective early graduates' opinions about their identity, role, scope, and worldview and future relating to the chiropractic profession. It's to explore the lived experience impact of chiropractic philosophy through chiropractic education at 3 selected time points through semi-structured interviews. And then to consider the impact of chiropractic philosophy in chiropractic education on the transition of the learner from novice chiropractic student to an early stage graduate. And the 3 time points are at the novice stage, the early stage of their educational career, the first 6 months, as a senior chiropractic student in their end stage of student clinic, and as an early stage graduate in the first 1 to 2 years post-graduation. So the research questions are looking at what are the opinions of Australasian chiropractic students and early graduates about their identity, role, scope, worldview, and future relating to the chiropractic profession. And what is the impact of chiropractic philosophy in chiropractic education on the transition of the learner from the novice chiropractic student to an early stage graduate? Does it matter from a lived experience perspective? These are questions I think that's important to ask. And the significance can inform the debate around the perceived value of chiropractic philosophy in chiropractic education in the process of professionalisation. So when we looked at worldview and philosophy, to get some perspective on worldview, look at that as a set of beliefs about fundamental aspects of reality that ground and influence one's perceiving, thinking, knowing, and going. And it could often be synonymous with paradigm, which Kuhn defined as a set of generalizations, beliefs, and values in a community of specialists, where it looks at, in this particular sense, we'll talk about chiropractic. Chiropractic philosophy grounds the science and practical application of the art in a distinct worldview. So the framework to look at this was through dialectical pluralism. So this concept uses a back and forth disputation and examination, and can include the logic of thesis, antithesis, and synthesis. The synthesis or the integration is a key requirement for successful equal status mixed methods research. Dialogically, dialectical pluralism involves continual and equal dialogue and discussion. And hermeneutically, it involves the continual process of interpretation and building on past interpretations. The important part of that is I'm looking at this from 2 perspectives, both constructivist and pragmatist. So with constructivism, we're looking at constructing knowledge, building individual representations and incorporating new data into current knowledge, and then assimilating or accommodating those views. With pragmatism, it's interrogating and evaluating ideas and beliefs in terms of their practical functioning. This is where we go from the academic world to the student clinical world to the I'm looking after patients who are paying me money for care. The research question is the greatest importance. It really drives the study and accepts that research is located in a social, historical, political, and cultural context. So mitigating bias, my personal bias is that chiropractic philosophy is important to chiropractic education, and the outcomes might reflect the opposite of that. So I'll be setting out to prove the null hypothesis that chiropractic philosophy is not important to the process of chiropractic professionalisation. Ways of mitigating that are done through the survey data, using objective language, working with my supervisory team to make sure there's objectivity in the thematic analysis from the interviews, and there's constant self-reflection on my objectivity as I go through the process, particularly with the interviews. I'll touch briefly on some of the lit review because this is heavier content, and I know I've only got a few minutes left. So Villanueva-Russell described the dissonance associated with the rise of evidence-based medicine and conventional chiropractic, and the heterogeneous discourse that was characterized by conflict over ideas and practice of the profession between actual practice versus academic chiropractors and leaders. This was published back in 2005 and 2011, so it's not a new concept, but has been explored over time too. Brosnan, as a sociologist, framed the profession's tensions within a doxa of a Bordeauxian field, which is bounded by one side, congruent with chiropractic philosophy, building academic credibility through institution founding, educational institution founding, and the other side publishing on problems with and lobbying for the removal of current applications of chiropractic philosophy